My name is Sonal Chandalia. I'm the Chief Nutritionist and Diabetes Educator at Dr. Chandalia's Diabetes Endocrine Nutrition Management and Research Center. Friends, it is very important to know what is a good checkup when you have diabetes. So one has to be very well informed about that to take care of one's health. Sometimes there is an extensive checkup that is done, but it can entail a high cost and a loss of time. Usually when a person has diabetes, you need very specific tests that need to be done, which are meaningful for your particular medical condition. And many such battery of tests that are done may not be required. Hence, it is important to choose any clinic or any particular, the doctor that you visit should be able to help you and guide you and select the tests for you. And also not only do that, but interpret it and give you the right treatment. So when we look at it, let us consider what are the things that you need to keep in mind. An annual checkup on diabetes is needed. So usually when you visit an endocrinologist or a diabetologist, there has to be a detailed history taken which will review all the symptoms that you have. And the clinical examination has to be done where there are certain parameters like weight, blood pressure, the retinal examination is done, peripheral pulse, the peripheral vessels, the feet. This is at least needed once a year or annually because we need to keep track that your complications are not happening faster than we would like. Now, in the annual checkup of diabetes also, there are certain blood parameters that have to be looked into. They are usually routine ones, but the important ones to note are like your HbA1c, which is needed for a person in diabetes to give you a 3-month average. Also, the other risk factors that need to be looked into, like there may be sometimes a need to look into thyroid, so TSH, your kidney, the creatinine, the cholesterol, so the lipid profile. But there is one very important test that most people don't know of, and which is something that you should always check with your doctor, is a urine microalbuminuria. Now, this is done to detect if there is any protein leaking out from your kidneys into the urine, because it will give you an indication that there are certain complications which are microvascular complications which are starting early. And they have to be detected in time even if you have very mild diabetes, because they can be prevented, but they definitely have to be treated. Now, usually these blood parameters are done when you're definitely 50 years of age and above. And also certain other cardiovascular risk factors have to be done annually, which will include sometimes a 2D echo or an ECG. Now, considering that these are the annual checkups that one should ask for or ensure that are done, the quarterly checkup of diabetes is that there should be always a short history, a system review taken, the blood pressure is always taken at quarterly checkup, and basic laboratory tests for the glycemic control, that is the 3-month average of HbA1c and a random blood sugar. So the recommendation for any individual with diabetes, what we would give is that there should be self-monitoring of the blood glucose, which is the method is given to you by a healthcare professional or the diabetes educator. How initially your particular in the titration phase, when your sugars or your blood glucose is being titrated with the medicine or insulin, in that titration and in that initial phase, there is more strict self-monitoring of blood glucose that we recommend, which evens out a little bit over a period of time once you have stabilized. So it is very important to understand that this is the way the entire protocol is set so that it is most effective for your glycemic control. Now, there can be varying timing of tests that are done in fasting, in pre-lunch, in post-lunch. So usually we use what is called in self-monitoring of blood glucose. A 9-point profile is what we advise to people with diabetes. And it is marked as to where and what days you have to do which. And accordingly, we are able to get a trend can be seen. Now, the HbA1c is done every 3 months. It's your average, as most of you might know already. And that is something that will give the doctor an idea how well you are doing, and how well your average is doing will tell them how well you're doing long term. Every 5 years, it's important that a detailed heart, kidney, retina, and nerve checkup is definitely done. After 5 to 10 years, a frequent checkup of the complications may be required because we want to ensure that either the complications are prevented or they are treated in time so there is less deterioration with the disease and with diabetes. Also, the cholesterol or triglyceride may need more frequent quarterly checkups rather than only annual after 5 to 10 years, and that needs to be kept in mind. So, to keep good health, all these parameters which are to be taken into consideration along with them being annual checkups or quarterly checkups are to be followed. And you should definitely dialogue with your healthcare professional or your diabetologist to ensure that these are undertaken.